This is Dr. Jerry Hesch, a physical therapist and a sacroiliac expert. I work at Hesch Institute in Aurora, Colorado. And the topic is micromotion alignment or advanced alignment of the pelvis. The sacroiliac joint only rotates a couple of degrees. Sacrum only rotates a couple of degrees, and these joints only glide a couple of millimeters. Even with injury, the amount of motion happening in these joints is very, very minute. Now, when you see a pelvis and it's very asymmetrical, it has to do with the fact that both pelvic bones can move together asymmetrically on a hip joint. So the top of the femur is a rounded surface that inserts here in the acetabulum, and that's the hip joint. And so the whole pelvis can move in three-dimensional space about the hip joint. And there are lots of large muscles that can control that movement. So when we talk about alignment of the pelvis, we're talking about a visual inspection. And that visual inspection cannot evaluate the very small movements that happen inside the pubic joint or inside the sacroiliac joint. Those motions are so subtle, only a couple of degrees of rotation or a couple of millimeters of glide, that you won't see a side-to-side difference. So there are techniques where therapists try to align the pelvis based on a visual inspection, but a much more precise evaluation is one that evaluates a very fundamental property of the pelvis. It evaluates a joint property of the pelvic joints, which is that micromotion, which the joint is designed as a force transmitter. So upper body forces travel through that, and lower body forces travel through the leg, through the pelvic joints. And that is evaluated through simple springing. I don't know if you can see the subtle movement happening in that pubic joint when I do a stress test, but it's very, very small. And you can have blocked mobility going through the pelvis, and it may have to do with a very small micro malalignment or an external restrictor of that movement. And this is called taking up the slack, where you push the bone through a normal movement and then movement stops. And at that point you add an extra force to see if there is additional mobility through that structure, or if that motion is blocked. And if that motion is blocked, then there are treatment techniques that restore that motion in a fairly normative pelvic structure that doesn't have severe pathology. And so this micromotion testing is a lot more precise than simply looking at alignment of the pelvic bones as they relate to the hip joints. And that is an important concept, and at the Hesch Institute we use the Hesch method, which is multiple directions of passive movement, micro movement, testing, and treatment of the pelvic structure. And you can find other YouTube videos that discuss this important concept. And so the point I'm trying to make is that we need to look beyond alignment of the pelvis when treating movement dysfunction and painful dysfunction, so-called sacroiliac joint dysfunction. We need to go beyond alignment and look at the micromotions, because that is a fundamental joint property, especially at the pelvic joint. And the Hesch method and at the Hesch Institute, we utilize these micromotions for doing a very extensive evaluation. And further to that, we also evaluate additional landmarks when looking at gross alignment, such as looking at the medial aspect of the sit bones on both sides, such as looking at the coccyx for side bending, such as looking at the sacrum in different positions, because it does have a little bit of movement. And so we look at it in prone and test, does it backward bend, does it forward bend? But then we look at it with the person in sitting and spring each quadrant. We look at the pubic joint, and in the traditional model, clinicians just look at these tubercles and look at the top of the pubic bone. In the Hesch method, we look at the lower part and feel across, looking to see if there's a glide dysfunction or a lower pubic rotation. And so this advanced method of evaluation takes additional considerations in the alignment model, but also looks at the micro movement model, which is very, very important. Thank you.